Thank you, Mr. Speaker. Members, I rise to present H.R. 124, which declares the month of October as California Promotoras Month. Promotoras, also known as community health workers, peer leaders, or health advocates, serve as cultural brokers who are a bridge between the community and the public health delivery system. They educate, empower, and advocate for community change in linguistically and culturally responsive ways. As a predominantly women-led workforce, they are the authentic voice of their community. Promotoras are trusted messengers and leaders in their communities, puentes de la comunidad, and essential workers who know how to connect with under-resourced and traditionally underserved communities. Trusted by often marginalized community members who go to them for information, resources, and guidance, they share similar characteristics as the residents they serve and provide servicio de corazón, service from the heart. Promotoras deliver healthcare education and services, particularly in maternal and child health, chronic disease prevention and management, such as asthma, diabetes, cardiovascular disease, and HIV/AIDS. This workforce is critical as it attends to the needs of the most underserved communities, closing health gaps and addressing systemic health inequities. Join me in honoring October as California Promotoras Month, and I would ask that the first roll be open for co-authors.
Thank you, Assemblymember Reyes. Assemblymember Carrillo, you are recognized.
Buenos días, Mr. Speaker. Thank you. I rise in strong support of H.R. 124, recognizing the great work that Promotoras do in our communities. They are very active in the city of Adelanto, one of the cities that I represent. And I just want to give a shout out to Leonor Garcia, one of the leaders in that area. I want to thank my colleague from Colton for bringing up this H.R. 124, and I urge your support. Thank you.
Thank you, Mr. Carrillo. Mr. Alvarez, you are recognized.
Thank you, Mr. Speaker. I rise in support of the resolution and want to thank our colleague from San Bernardino for the work done, not just in recognition with this resolution, but over the years for the Promotoras. My first opportunity to work in public service was in public health 27 years ago. At the age of 15, I was actually a promotor of salud with our local community clinic. And we were working to ensure that young people at that time in the 1990s, the epidemic of teen pregnancy prevention was work that the promotoras were leading in the 1990s to make sure that especially the Latino community, which had higher rates of underage pregnancy, was work that we were trying to do. And it was the mentorship that I received from the promotoras in my very first job that I think really started to lay the foundation for me to be able to be doing public service. So I want to acknowledge the promotoras. I still remember them well. I actually want to name them. My very first boss, Marta Flores, who's now retired, she would be very, I think, shy to say that I'd be recognizing her. My mother, who ended up becoming my mother-in-law, Maria Miramontes, still a promotora to this day, over 30 years, and then many other women who helped, again, teach me how to work with our community and give back to our community. So thank you to our colleague for recognizing them.
Thank you, Assemblymember Alvarez. Dr. Arambula, you are recognized.
Thank you, Mr. Speaker and members. I rise today to honor our colleague from San Bernardino and all of those who are bringing attention to promotoras. It's important for us to make sure that we are providing linguistically and culturally appropriate care for all Californians. For us to do that effectively, we have to work with trusted messengers who are on the front lines, who speak the language, who understand community. I'm grateful for all of our advocacy in this building over the last couple years as we have driven resources through our budget to uplift community health workers and promotoras. Specifically, I want to identify Maria Lemos and Visión en Compromiso, which received $10 million in our last state budget, which allowed us to expand services for promotoras across our state. As we continue to expand healthcare access for all, we need people out in community to be trusted messengers and to make sure that we are providing the best care that we can. I'm grateful that our state is a leader in this space and would urge your support for H.R. 124.
Thank you, Dr. Arambula. Assemblymember Garcia, you are recognized.
Thank you, Mr. Speaker and colleagues. I rise in support of House Resolution 124. And much has been said already, but I want to just emphasize on one particular point. Promotora's work in our region during the pandemic truly became the heroes alongside many of our essential workers to ensure that the community had the information they needed, the access to the resources as simple as in many cases the PPP equipment, masks, you name it. And so I think it's appropriate that I rise and say thank you to the promotoras of our region, of the state, for the work that they do day in and day out, and appreciate the resolution before us, and I rise in support.
Thank you, Mr. Garcia. Seeing no further debate, would you like to close, Assemblymember Reyes?
Yes, I want to begin by thanking my colleagues for lending voice to a group that has been so important in our community. And if I may, in Spanish, les quiero agradecer a las promotoras por estar aquí con nosotros, aquí en su casa, para que podamos darles el honor que merecen por todo el trabajo que han hecho en nuestras comunidades. Les agradecemos muchísimo. And once again, I would ask that the first roll be open for co-authors.
Thank you, Assemblymember Reyes. And with that, the clerk will open the roll for co-authors. All those vote who desire to vote as a co-author. All those vote who desire to vote as a co-author. Clerk will close the roll and tally the votes. There are 52 co-authors added. Without objection, we'll take a voice vote on the resolution. All in favor say aye. Opposed say no. The ayes have it. The resolution is adopted. Assemblymember Reyes, you are recognized for your guest introductions.
Thank you, Mr. Speaker. I'd like to welcome my guests from Visión y Compromiso, one of the most preeminent organizations for our promotoras. Specifically, and she's already been called out earlier, Maria Lemos, their executive director, as well as her team, Ricardo Juarez, Raquel Ponce, Silvia Hernandez, Rachel Rios, Ruben Ruiz Salazar, Leslie Rodriguez, Leticia Molina, Silvia Gonzalez, Silvia Hernandez. Established in 2000, Visión y Compromiso is a nationally respected organization dedicated to improving the health and well-being of underrepresented communities. Today, they're the only organization in California providing comprehensive and ongoing leadership development, capacity building, advocacy training, and support to over 4,000 promotoras and community health workers. Join me in welcoming them to the California State Assembly.
Thank you, Assemblymember Reyes, and welcome to your guests. Thank you for being here.